So I want to be very clear about what this big betrayal of the bill will do. People in Washington State will go hungry because of this bill. They will lose access to health care because of this bill. Our lowest income residents will be worse off as a result of this bill. Why? All to pay for tax breaks for the wealthiest Americans. That's why this is happening. It's difficult to overstate how devastating these cuts will be to Washingtonians. They will bring our health care system to the brink and harm people in every corner of our state. I want to point out that Washington State will be among the states hit hardest by Medicaid cuts and changes. We were at the forefront of expanding health care coverage, thanks in large part to a lot of the hard work of people here, legislators, community activists, Governor Inslee, and many others over the years. We're at the forefront of expanding health care coverage to more individuals under the Affordable Care Act. This effectively reverses all of that progress. One other thing I want to emphasize is the legislators who are here and statewide officials understand, and our state treasurer understands, is about 28% of our state budget comes from federal dollars. That is not unusual for states across the country. A big part of the budget that we implement every year comes from federal dollars. So to give you an example, on the Medicaid cuts from this big betrayal of the bill, that will be at least a $3 billion annual hit to Medicaid funding in Washington State. At least 250,000 Washingtonians will lose Medicaid coverage. Another 150,000 will be priced out of the health care exchange. Hospitals in Washington State will lose at least $1.5 billion in reimbursements in 2031. And I want to emphasize this. You may not be on Medicaid. You may not depend on Medicaid, but guess what? The hospital you go to, they depend on those reimbursements. Hospitals, both rural and urban, will close as a result of this. That's not just coming from me. That's national organizations that made this clear for hospitals across the country. UW-Medicine will take a major hit, losing at least $330 million every single year. 2/3 of that from Harborview Medical Center. That means services at the state's top trauma center, a hospital that provides life-saving care, not just to people in our state, but Alaska, Montana, and Idaho, are threatened.